Other side, and cat gut. Is that really made from cats, by the way? Where did cat gut come from? Speaking about suture. Any ideas? All right, back in medieval times, there was a kit. It's kind of like a little three-strand guitar, or a little violin. And they took sheep intestine, and they pulled out all this and rolled it and dried it, and it became the strings. Well, they used chromium salts, and ultimately this became the suture back in the medieval movies when you're seeing Mel Gibson and all these guys with these movies. That's what they were using, is actually sheep intestine threads. So Dr. Setzer, you can see the main uterus body is going straight down in the front of the incision where he's getting ready to clamp, is right at the ovary. And that little bulge to the head of the dog, the head is on the right to you all, or the finger, the location. And he's going to transfix ligate. Big fun word. Basically what he does is he does not want his suture, or his suture material, stitch, to slip. So he goes right through the middle of it, catches some of the tissue, then he can wrap it around. And no matter how much it pulls or jumps around, we know this is not going to come undone. So this is a little safety factor that Dr. Setzer is going to do for animals to the side. He's tying off all of those, okay? Have you all noticed that the only blood that's there is what he's actually touched his drape with? There's no bleeding from his incision. This is the sign of an excellent surgeon. So as he's going through, he's again transfixed or tying through. Anna's doing a great job monitoring. We've got a drip rate on the monitor, and her pulse rate and oxygen is what? Anyway, so her oxygen saturation, if I can read through the mask, is 100% oxygen saturation, and I'm going to guess that her pulse rate's about 80 something. So Ashley's going to be nice enough to flash the pulse. There you go. Her heart rate's at 141 beats per minute. Her oxygen saturation is at 96%. So there's also a little bit of a audible monitor, a little beeping going on, so that the doctor subconsciously can also monitor the anesthetic as well as your technician and so forth. The other thing periodically is the technicians will reach up, and we've got a small little anesthetic bag. You don't want that to overfill. You don't want it to fill with more air than the dog can breathe. So periodically they're going to reach up and express that and not overinflate the lungs. So Dr. Setzer has got everything cleaned up for really smooth removals. And this is a spay. We just have some new faces that came in. Annabelle's a 45-pound Great Pyrenees mix. Dr. Mark Setzer is doing the surgery. Anna Ruiz is technician from Oklahoma State University freshman class, and Miss Ashley Simpson at Animal Medical Surgical Hospital. Well, he's being very careful to make sure he gets both sides of this fascia. That way there's no tearing. Muscle doesn't have a lot of strength. If you've noticed, if you took a little something in a steak and just pulled it, you can kind of pull right through it. But the fascia is where the holding power is. So he's being very careful to make sure he gets both sides of that. And it's right along the linea. And if you notice, he's doing a double stitch, or a surgeon's knot. He throws 2 loops, pulls, and then loop and loop. And that secures the knot permanently. And he reaches in with his little forceps, grabs both sides. Are there any questions so far? Right in the middle is the body. So in each hand are the ovaries, the very small ovaries. And at this point, it's going to go ahead. They probably turn the anesthetic off, and they're going to let her wake up smoothly. So with his fine little hands, he's going to reach up and show us. Depending upon what you use, if you're using propofol, which is a short-term induction, lasts about 15 to 20 minutes, and then we use sevoflurane or isoflurane, These dogs can be up within 5 minutes, sternal with their head up, standing and walking within 15 to 30 minutes. So, Dr. Setzer, we appreciate all your crew, Anna and Ashley, and he's going to keep all the tissue inside the glove. Are there any other questions?